Hey, I'm Ron with Best HQ. Over there is Brenda and a few of the other team. Hey, so we're welcoming people into the house. So the virtual house. If you see somebody, good time to unmute and turn on your video. Say hey. Hi, Mr. Autry. Good to see you, sir.
Yes, indeed. I'm in my mobile office again. I have a tour of wherever I want to have to see.
Hey, Amy.
Hey, how's it going, Brenda?
Good. How are you?
I'm doing well.
Good. Good. It's good to see you.
Good to see you.
Hi, Wasi.
Hi, Tamara from the health department. And Amanda from ODHS. Great to have you here.
Hi, Caitlin. Sarah. Wow, this is filling up fast.
Indeed. I think there's nearly 100 registered. So
yeah.
There's
Hey,
Amy.
Bethany.
Hey, how are you, Brenda?
Awesome. How are you? I'm so happy to see you here. Glad you could make it.
We're excited to be here.
Great to see you, Bethany. I hear you got a big, exciting event coming up next month.
Yeah, we're going to be at Oaks Park doing a family field day.
Awesome.
Fantastic. I love it.
And maybe share folks who you're with, Bethany. And this is all about connecting organizations and community resources out there, making a difference.
Yeah, I'm with Everyday Owl. We work with 18 to 24-year-olds through curriculum and content and coaching to help them develop life skills and progress into the adult life, with their best foot forward.
Awesome. Bethany, does that also mean connection to maybe some job opportunities with some awesome businesses on this call today?
Absolutely.
Love it.
We've got Justin from Salvation Army with us. Welcome. And Caitlin from Cupcake Girls, welcome.
Hey, Caitlin, I'm so happy to see you here.
Did I hear
Thank
cupcakes?
You know what? I'm not going to steal Caitlin's thunder, but when you learn about the amazing work they're doing, Ron, you're just going to be over the moon happy with regard to purposeful projects.
Well, that's a good setup. Caitlin, can you share a little bit?
Yeah, sorry. Hello. I don't want to have the camera on right now. I've got my dog and my cats are just like being mischievous today. I've got 2 new kittens, so I'm just going to leave the video off. But yes, I'm with the Cupcake Girls, and a couple of my other colleagues should be joining us as well. So we are an organization that supports both willing and unwilling sex workers. So we are working on some decriminalization work, and we do a bunch of advocacy work for our clients, put them in contact with places, medical care, dental, legal, anything that they might need, just kind of getting them, helping them get back up on their feet again, because that population is so stigmatized. So we love the work that we do, and hopefully, so Amy should be here, and she's our ED, and she'll probably talk more about some of the work that we're doing.
That is awesome. Indeed. We love cupcakes.
Ron, this is Wasi.
Yeah.
I like the idea about what you mentioned a little earlier about like putting our organization names next to our name, so everybody who is participating can see where we are from.
Yeah, that's so awesome. Thank you, Wasi, for bringing that up. So if you're just joining us, can you please put your name in the chat and kind of who you're with? And it also helps to know, too, if you want to drop your contact information in there so that other people on the call can find you when they're trying to look for an opportunity to do business with you, that'd be great. And then also, too, it's helpful to know if you're a for-profit or nonprofit organization sometimes. Just kind of getting it out there, who you are, who's in the room, what do you do, what are you all about?
There you go. That's perfect. Yes, this is meant to be an interactive. We'll be getting going in about 4 minutes as the screen share shows. as Wasi noted, it's really good for us to help get to know each other. We do anticipate we have close to 100 folks registered, so that it'll fill up pretty well. But you'll be able to see some of who's here by actually changing your name, your Zoom name. So if you hovered over your picture on the Zoom screen, in the upper right-hand corner of your name or picture, you'll see 3 dots, and click on that and you can rename yourself. We suggest a syntax similar to what Wasi mentioned there, your name, and then in brackets, your organization, to help communicate that through the course of the meeting. There will be some Q&A opportunity for the second half of the meeting, and it'll just make things a little more engaging as we hope to help you connect and grow and show the power of community through this. Also, one other user tip: in the upper right-hand corner of your screen, your Zoom screen, you should see just below the X of your window a view button. That view button, if you clicked on that, it'll give you options between standard, side-by-side, speaker, and gallery, depending on your version. We would suggest and request that you click on the side-by-side speaker, as we will be moving presenters in and out of Spotlight through the course of this hour together. Who else do we have in the house that just has to say hi? Turn your video cameras on here. We still have a little bit of open mic time, and then we're gonna kind of close down. There's Mike. Good to see you, Mike.
Hey, John.
Good to see you, Ron.
Hi, everybody. John Sheehan from Mount Hood Community College here.
So good to have you here. We love having Mount Hood Community College.
Yay.
Awesome.
This is very exciting. Thank you. I'm the Community Resource Coordinator, so this is right up my alley.
I love that you're here. I remember doing road shows for Governor's Marketplace and talking to several of folks from the community colleges saying, wouldn't it be awesome to have a one-stop shop where we could connect with community partners, for-profit, nonprofit, government, whatever, to
my
say,
goodness.
Hey, do you have this? It's like virtual Go Fish.
It's lovely. Yes.
So good to
We've
have
been looking for the control tower, so to speak, to send us off where we need to go for a long time. So thank you for this.
Yeah, it's fantastic. We heard from people in your community, so you'll hear more about this during the presentation, but where this has stood up in other parts of the state, people kept saying, why aren't you focusing on the Portland area? Do you know how many resources are out there? Knit us together.
Yes. I imagine that was a pretty big task, though, in this area. There's a whole lot going on.
Well, you're all part of it. So I hope that you'll invite friends and people who aren't able to join us today. Just point them to the video and encourage them. There's kind of a makeup day on the 29th. And then tomorrow afternoon, Clackamas County has a virtual forum like this one. So it's not too late. Tell a friend.
All right. We'll get our friends on it. Absolutely.
Awesome. Hi, Sydney.
Brenda, I want to just mention one more thing.
Yes.
So even if you're not from that county, you can still participate in those forums.
Yes, absolutely. Yeah, yesterday was Washington County, and afterwards we got some emails. People were saying, hey, I need to share this out. There were other partners here, public sector and private sector, for-profit and nonprofit, that we wanted to see kind of get this information. So we were able to follow up and invite them to come to the today's forum or tomorrow or the 29th, and to look at the recorded message that's available online through Best HQ. And I think Ron will tell us how to find that.
You bet. Are you ready to start this party, Brenda?
I am always ready.
Let's get it going. So good afternoon, one and all. Yes, I'm Ron with the Best HQ team, and this is Brenda.
Oh, hi. I was reading the chat. I saw Justin. Hi, I'm Brenda Pearson, and I'm the Business Partnerships Program Manager for Department of Human Services and Oregon Health Authority. But this is not a state-run endeavor, just volunteering to help out in the community and sponsor this awesome event for everybody.
Indeed. We're so excited everyone could take the time to join us. This is truly a community and individual life-changing initiative that has incredible potential, and the potential is only limited by literally the people in this room and the 3 other forums, and then the future community resources partners that are going to be coming together. So Brenda, this is an exciting time, one and all.
Yeah, I'm so excited. I love it. So, hey, just super quick, should we do some housekeeping real fast?
Let's do that.
Drop your name in the chat, kind of tell us a little bit about you, who are you with, that kind of thing. Pass it on, share it with a friend. At any point in time, you can go to PDX-CRN.org and fill out an interest form just to kind of let us know, hey, I want some more information, or I want to be part of this and on the steering committee or whatever. And we'll get right back to you. But stay tuned. There's some good information today. Right, Ron?
Absolutely. In fact, we do encourage the exchange of information in the chat. There will be a Q&A later. So we have a little, first part is presentation, but then some Q&A later, and definitely time to engage. So what's really important about this endeavor is that it is multi-dimensional and multi-agency, public, private, for-profit, nonprofit. Everybody is in. And that's really the force multiplier here, is that this is for business. It is for agencies. It is for nonprofits, for-profits. And that's really the most exciting piece, right, Brenda?
Yep. I love it. It's for everybody. Businesses, individuals, people. This is where we get to be online and connect. And it's this sort of super cool thing where resources and people and businesses all get together and get to be a community on an electronic platform. So yeah. Hey,
Indeed.
should we introduce Tim Sinatra?
You bet. I just one quick little item before, just to encourage folks to little pro tip on Zoom. I know most of us are pretty Zoom proficient, but just in case, in the upper right-hand corner of your screen, just below the X, don't click the X in the far right-hand corner. That will close Zoom. We don't want that, but there's a view button. We'll encourage folks to click on the speaker view. As we're going to be going like we're doing right now, in and out of Spotlight Speaker, and that'll provide an optimal experience. Also, indeed, you saw the notice this is being recorded. We are putting it together a YouTube for future posting on a YouTube space. We'll drop that in the chat later on. And then finally, as Brenda mentioned, everything is accessible, will be available through PDX-CRN.org. Are we ready?
So ready.
Guest? Let's do
yes.
this.
We're very thrilled to be able to have some time with Tim Sinatra today. Tim will be giving us a presentation and telling us kind of what is this Community Resource Network? How was it born? All those good things. It is my honor and privilege to introduce you, Tim, as the CEO for YMCA for Marion and Polk counties, and just a huge champion for community nationwide. Everywhere you go, community connections kind of light up. So thanks for being with us today.
Thank you. Thank you so much, Brenda, Ron, and thanks to all of you. I know everybody's day is very busy, and to take the time to carve out to learn more about this is just fantastic. So we're going to respect that time, share with you a little bit about the Community Resource Network. I'll call it the CRN throughout the presentation, and then we've got some great Q&A after that. So thank you for coming. I'm going to share my screen, and then we will jump right into this, which will be great. Okay. Brenda, can you see the slide?
I can. Looks good.
All right. Well, thank you. So a little quick note about my background. 29 years in the nonprofit industry, most of that with Boys and Girls Clubs of America. and the YMCA, and 3 years actually with the Department of Human Services. Had the privilege of learning and working beside Brenda Pearson. So it's great to be back here and helping out, really help communities connect together to really dictate their own destiny. So I'll tell you a little bit how the Community Resource Network started. Back in 2005, I was the executive director for a Boys and Girls Club in Charlottesville, Virginia. And I went to one of those usual meetings. I think we've all have been to one of those meetings where you're sitting in there and you're talking about the gap between the need in your community and the resources available. And we continue to say to ourselves, if only the state gave us more money, we could. If only that philanthropist or foundation was able to fund this, we could. And I kept hearing that, and I kept saying, we can't keep waiting on somebody to come save the day, or when funding comes through. There's got to be an opportunity, or the strengths that already exist, the potential that already exists in our community to meet many of these urgent and emerging needs. And so I went back and I thought about it and talked to a few people and came up with this first edition of what was called the Community Resource Network, very archaic, on a website, gathered about 170 partners from a multi-sector approach. And we used this to really strengthen the safety net of that community, while also building springboards of opportunity to leverage the opportunities that exist and the potential that exists within the communities there. And so coming from that point, I moved to Oregon and met a gentleman by the name of Wasi Khan, who's on this Zoom call today. And I said, Wasi, check this out. He said, Tim, I can make it much better, much efficient, more effective with data, and we can track things, we can move even faster. So we spent many nights working with some of his friends via Zoom and other ways of Skype and so on. And next thing you know, we have 2 wonderful pilots here in Oregon, in Eastern Oregon through 3 counties, and then Marion County has a community resource network. So we're going to share a bit about that today. And it's something that is so simple, so easy, and so easy to set up. I can't tell you how many hours in my life I've sat at community meetings where it was great talk, great dialogue, but we struggled moving to action to create population outcomes. And so this was a way that we could move. It has worked. The 2 pilots are showing it again, and it did work back in 2005. So here's the first part of it. So first is, I'll share with you the purpose of the CRN. As I said, it's basically firming up safety nets and expanding opportunities, and really doing it from a multi-sector approach of alignment. So looking at that private sector innovation, public sector resources, and then the power of mobilizing the social sector networks. And in doing that, we can connect social priorities with resources from a strength-based approach that already exist within communities to meet pressing needs, not a month from now, not 3 weeks from now when that committee gets together, but in the moment, today, tomorrow, the next day. And it does help out with that urgent need, and also helps strategically from that long-term need of some of the challenges that keep repeating themselves. How do we get into the root causes of that and really create some sustainability in our efforts and our investments that stick for the greater community? And so that's kind of what, and really, how do you define success? Well, now we talk about clicks, but back then we talked about it as 2 phone calls to success. When you can create a platform, when you can create relationships that are so strong that it only takes 2 phone calls to get whatever you need for that client, that family, that child, that adult, that quickly. And that's what was the goal of creating a platform using technology to accelerate impact. And so just a couple ground level viewpoints that I've seen over 32 years. There's no one system I've seen, and maybe you have, but I haven't, where you can have that system that collectively meets all of the needs of any community for the residents. I think there are some great platforms out there. I think there are some great coalitions out there and some collaboratives, but we've never seen one system. And a lot of times it takes many tools for a community to have in order to really help and meet the needs of a community. When I worked for DHS, I would hear many times that people would say, well, those are DHS's kids or DHS's families. And I would stop people and say, no, those are your neighbors, your friends, your colleagues, your coworkers, and that the community should own their destiny, not one organization, not one nonprofit. And so this is a really effort towards creating another tool that can be there that collectively can have everyone participate on it. And so the other aspect from the community level viewpoint is shared outcomes. Many times you'll see a great, strong economy and you'll see strong communities, but it doesn't guarantee that everyone in those communities are benefiting. And it really helps you to find where the people who aren't benefiting from it and mobilizing that community with the strengths and the progress that is happening to also bring them up to the same level so that they can experience all of the key opportunities so they can reach their full potential. And so shared outcomes in one system is something that I've come across in many years through 5 states. When we started to build the CRN originally, we were really trying to answer these questions. What happens when service referrals are not met? Does the need just go unmet? Where can I access community level data to inform your organization or decision making? If you have an organizational strength, many times just the name of your organization doesn't really articulate all the strengths you have within there. And so how do you let everyone know that, hey, we're good at this, we can do this. This is something that we prepared ourselves for. How does everybody come to understand that? And if you have resources or an event that you put a lot of time into, I heard a family field day coming up. What a great idea. How do you get that word out to the families who might benefit from it the most, or organization who can help participate and support that? But in the end, you know, I've heard so many times there, when there's urgent needs that sometimes we have to wait. Well, we got to wait till the board meets next month to approve that because it's kind of out of what we normally do, or the situational, reaction team only meets once a month to consider those. And many people don't have the opportunity to wait a month for food or shelter or safety or something that's basic that can actually leverage an opportunity for all the good work they have. But there's one barrier sitting in front of them that unfortunately they can't meet, but they can't wait a month for that next group to meet to decide the fate of that barrier. And so we started to say, well, we're going to build a platform so that when referrals break down, that there's something there to help support that. And even more so, now it's morphed to where people are using it, not just when referrals break down, they're going to it as the go-to opportunity to accelerate meeting the need of the individuals that they're supporting. Many of you know or have heard of ACEs, and if you've heard also, there's the para-ACEs, both the below ground, kind of those root causes, and the above ground for children. And what the CRN does is help transform experiences and environments to really create that other side of this slide here, the supportive childhood experience, but also for families and adults. And you can see that the benefit of the CRN actually addresses both sides, the leaves, the beautiful leaves and the colors, but it also addresses the root causes and supports those root causes to turn them into a positive, a foundation where a beautiful tree and opportunity can grow in every community. Also, I think we all know this working in this field that, in anything we do, there's kind of 3 levels in the pyramid. There's those basic universal supports, things that are pretty easy to provide and connect to. And we know it's kind of that prevention and asset building kind of supports. It's that 80%. And if we do that right, it helps families, adults, and children not have to enter into those more specialized supports or those intensive supports where you really have that high-level intervention or high-level prevention, which when you get to the top of the pyramid, that's where most of the trauma has already happened, and it takes quite a bit for families and children to heal, and it's very, very expensive. But if we can put our efforts into the 80% and we can get in front of things before someone becomes homeless, before abuse takes over, before neglect sets in because of an uncertain situation. We had a family recently here at the YMCA that was called to us from a local partner, and They lost, the husband had passed away and they had 8 children. Now you've got a single parent raising 8 children, and things were going down fast. And luckily with the CRN and the connects of the supports, things had changed for that parent immediately, rather than taking multi-visits to different organizations and so on. It was really that one call, that one login, get it going, and let's get everyone behind this. So it doesn't have to go into an extreme in that intervention zone at the top of the pyramid. When you think about the focus areas of the community resource network, there's really 3 focus areas. Enhancing that connectivity, so getting all your partners at the table. Many times the nonprofit sector is really leaned upon to solve everything, or the agency like DHS. And that's really unfair. In order to have long-term sustainability and to really address the critical needs, you need the firepower of everybody involved. You need the businesses, the agencies, you need the faith-based groups, the nonprofits, everyone coming together where we can look at, here's what we have to offer, and then start to move on that. And so as you get everyone at the table, then we say, well, how do we align? And what the CRN does by building profiles, and you build your own profile, you basically tell the platform, here's what I have to offer. And then when a request comes through, there's an algorithm that picks out all the people who said, if this is the issue, we can do something about it. And you get notified within a nanosecond. It's very fast. And so how do we take the beauty and the strength and opportunities that exist that we all don't have time to like inform each other on, and is always changing, and keep that relevant in real time? Well, that's what the CRN does. And then also supporting local capacity building. You know, I've often heard when I've met, go into the community and really try to seek to understand how we can be more relevant, you'd hear many people in community saying, Tim, is this just a hollow promise? And I say, well, what do you mean by that? They said, well, we have all these organizations that come into our communities, they get a grant, they do good work, but then the grant runs out at the end of the year and they're gone. And although we knew they cared, but they weren't there, and nothing gets solved that fast. We really needed them to stay around longer. And so what this does is it creates capacity and staying power for communities to continue to build the momentum on the critical opportunities and the critical needs, and make it sustainable. And the cost of this, the ongoing cost of the CRN, is so minimal. It's amazing. And there's really no barrier for any of the partners as far as usage, because many times it's set up so that it's a free service for everyone. And so we talked about building community resiliency really depends on using the strengths, utilizing the private sector innovation, public sector resources, and then this great strength of the mobilizing the social sector networks. So I give you a quick example. The CRN was actually built to, as I said earlier, to respond when referrals broke down. I'll give you a real-time example for myself. I was going to work one morning as the Boys and Girls Club exec here in Marion, Polk counties, 6:30 in the morning. No one's in the club yet. I wanted to get an early start. I hear someone walking up behind me pretty quickly. I turn around to greet them. It's a parent, and he says, do you help children? I says, we do. What kind of help are you looking for? After we sat and talked, he had a child he was taking care of, a single parent who he housed, but they didn't have dental insurance, and the child, 8 years old, had a horrible abscess. And you know, if you let an abscess go, it can turn out pretty detrimental and even take a life. And he had gone to 3 places that were supposed to, he was referred to meet that need of the child. And halfway through the process, someone says, oh, because of this, we can't help you here, so you got to go there because of this, and so on. And next thing you know, he's standing at the corner of, hey, and what happened? There's nobody here. It's a gap. And that's where you see that adverse community environment or experience start to take hold. And so he just happened to pass by the Boys and Girls Club. We just happened to have an operatory where we had 23 private dentists donating 1 day a week to our operatory clinic. and we're able to take care of them. And that's where a CRN, even with a need like that, could have been posted, and we would have picked up on that immediately and solved that. Because as the referrals would have saw that they couldn't meet that, the referral agency could have logged in a ticket for the CRN for that individual and had them met like 2 weeks earlier. And so the question, as you can see, the title of this slide is, do we want to define success by choice or by chance? Chance is like, well, maybe it's going to happen, but choice is where you mobilize the entire community when there's a need. And you say, this is one of our community members, doesn't matter who they are, what they look like, where they come from, what their circumstances. It's a need, so we're going to take care of it. And we're going to mobilize everybody until it gets taken care of. And so how we do that is gathering everyone onto the tech platform. We look at their strengths. They kind of build their own profile and say, here's what we can offer when it comes. And then we utilize technology to make it very easy. One of the things Wasi was great about when he was interviewing me about building this new platform, I said, Wasi, many of the people who will use this have maybe 1 or 2 minutes of time. They have so much coming at their plate that we've got to be able to have them to build a ticket within 1 to 2 minutes. And it's got to be that fast, because it's just, most people are so distracted and overwhelming with the amount of work, especially in our field. We need to make it easy for them. And so he did. And to this day, it's still working like that in the 2 pilots. It does mirror the collective impact approach. It has many of the tenets of collective impact, and it's a platform. And we use it as we see trends that continue to come about. For instance, if you see in a neighborhood that there are multiple requests in the East Side neighborhood for after-school programs each month, at the quarterly meeting, you'd look at that data, you'd build a little triage team to go study the need in that community, and then you'd look at the profiles of the organizations involved, and you might invite a Boys and Girls Club or a YMCA to go open up in that neighborhood, so they have something in that neighborhood. And then you would then challenge the whole CRN, anyone who could help them get started and moving forward with some finances and just some connections to get moving forward in there. So it addresses both the urgent need, but as you see trends of things that keep repeating, you start to set up a more strategic platform of a group that goes after it and build a task force for that. So it keeps you relevant in real time. And so that convening platform with sharing data, not just from the CRN, but sharing data that other organizations have and are collecting at certain levels. And then at the quarterly meetings, connecting program performance, meaning the impact of what we're doing in our organization with moving the needle on population outcomes. And that's the challenge, is that one of the things when I've come out of 5 states and communities, why things really take hold, you're doing real well, and then they fall back and, and go backwards a bit, is really having a community dashboard where you're saying, these 5 things are most important that we always invest in and keep an eye on. And here's what we consider success and not success, and keeping that in front. But there's also many other needs that are related to that and underneath those, but having a community dashboard, and CRN can help with that, keeps it priority in front of everybody about how you should invest your time, pivot your organization, and mobilize your resources. And so this is literally how it would happen. I'll run through it very quickly, and I'll give you kind of a real-time one as from a teacher. So there was a teacher, she sees her student, the student's struggling to read the paper. She could tell probably needs some glasses. She calls up some of the local resources. She thinks she could get a free eye exam, some glasses, but struggles. The teacher's just not gaining any ground. The parent can't afford it, doesn't have any eye insurance or anything like that, doesn't have a car. So she knows she's a member of the CRN, loads up a ticket. And what we did was, here's the power of the CRN. What we found was if you loaded up a need and you asked someone to meet the holistic need, many times it wouldn't be met. But we would break down the need into the pieces of it. So needed a free eye exam, needed transportation to the eye exam place, needed someone to buy the glasses, needed someone to go to the glass place to get it fit and so on. And so that ticket gets broken down into the parts of it, gets then logged over to the CRN coordinator. A human looks at it to make sure there's no personal identifying information on it, shoots it out to the CRN. The CRN, through the algorithm, finds who says they were interested in helping out with something like that. And immediately 3 organizations pop up. And within 45 seconds, 3 organizations committed to providing transportation, paying for the glasses, and a free eye exam within 45 seconds. And then a timer is set within like 2 weeks or a week to go have all of that done, meaning the eye exam and then the glasses. And so you set a realistic timeline and then meet with the parent and says, guess what? We found a free eye exam, we found transportation, and someone who will pay for the glasses. And so that's how fast we used to measure success as commitment within seconds. And it was rare that it would go over 45 seconds if you had the greater community on the network. And so we talked about, this area of how the convening platform quarterly comes together to really look at the data and show, what are the requests? Where are they coming from? Geospatially, what types of requests, and are they repeating? And then if a priority cross-sector team needs to be built to go look at that and come back with some suggestions to address some of the root causes that are repeating in that community or that need, it'll be formed by a group related to the CRN or other people. And so you can see some of the benefits here. No cost to members. You can have multiple people in your organization. So in Boys and Girls Club, we were signed up as an organization, a member, but all of my directors could get onto the CRN, which then limited the amount of time they would need to search for things. Before they'd have to call 4 or 5 partners to get something met. Now they log it up on the CRN, and within 45 seconds, they're getting people already picking up on it saying, oh, we'll take care of that for you. So now my staff member could meet with maybe 30 or 40 or 50% more people a day, more kids a day to help them, because technology helped to accelerate connectivity and impact. And so, as I said, the Community Resource Network is just one of the tools. There's in every community, there's partnership care teams already built. There's already some coalitions and collaboratives that are already established. Neighborhoods usually have something going there. And what this does is it becomes a tool to really connect all of those. But it's another tool. It's not the answer, but it's another tool that really helps everyone, no matter whether you're on a collaborative group or you're an individual organization or an individual, you can get on here and help to then create a thriving community where everyone can be their best. We have 2 pilots, one in Marion County with 250 active members, 147 organizations. You can kind of see the breakdown there. And the backbone agency here is Marion County. They host kind of the convening platform. And then we're really excited also about Eastern Oregon, who actually decided to do it from a 3-county approach. And so the counties are not just helping out their local communities, they're actually helping the other counties out too. And the backbone agency there is the Building Healthy Families. And they just started up not too long ago. And it is amazing. They started October 2020. It is amazing how many people have signed up and how fast they're meeting the needs. So I want to thank you for all that you do and turn it back over to Brenda and Ron.
Yahoo! I'm so excited right now. Hey, Tim, I've been chatting a little bit with John, and only because I've heard the presentation and he had some really amazing questions, and we're going back and forth, and he's saying, wow. And John, I don't want to steal your words or your thunder, so I'm going to ask you to talk about it. But he's saying, this is the missing link. This is what we've been missing. So, John, can you talk about that a little bit? And even about how it helps net up there. Did I lose you? Or do you have your mic not on? I can see you, but I can't hear you. I'm watching the chat.
Yeah, I was getting, sorry about that. I was getting a message saying Zoom was not allowing me to unmute.
Oh no.
Probably wisely. It knows who I am.
No, I'm loving. You have some great things to say. I'd love to hear it.
Well, I think we're always trying to put together directories and things like that. Things to share with students or our clients, both so they can have direct access to information and resources. But they're passive. And they're passive networks. They themselves don't do anything. And so if someone's in crisis and they need something to pick up where they kind of are, from where they express a need and run with it, that's often the case. These static passive networks fall completely short, and so that's why I'm saying there's a huge gap. That this could, I'm really excited about this meeting. There are all kinds of cool online searchable databases of every kind of, basic need that that a person could have, but again, they're passive. And so something that actively connects folks is just really exciting to me as a community resource coordinator. So I'm really looking forward to hearing about the nuts and bolts too, and how does this work, and what would it take to get a network up and running in the greater Portland region?
Yeah. Also, too, John. Sorry, Ron. I just had one last thing. John, I was going to ask really quick about net up there for your local neighborhood emergency preparedness. Whoa.
Right. It's fascinating to think that the city of Portland has, in its emergency management department, has a volunteer program that trains up neighborhood volunteers to respond to natural disasters. Think the big one, think the heat wave, and it mobilizes these volunteers to do the things that need to be done during those disasters or emergencies. And I'm just thinking, how do we kind of link the kind of cross, the immediate, like there's a request here, how do we get crates of water to the folks who are in a neighborhood that's lost their water because whatever, a water main was broken or something. I am only in a training there, so I don't know what their full capacity is. This is just kind of a brainstorm, but it seemed like a possible place where there's synergy.
Yeah, it's perfect. You'll be so amazed. Like, I saw requests coming in Marion County and in Eastern Oregon. Hey, need an air conditioner. It gets answered. Hey, need a bike. It's answered. Art supplies. It's answered. I mean, it isn't just people in poverty. It isn't just kids kind of in care or falling through the cracks. It's everybody, right? Yesterday, there was a post in Eastern Oregon. We have a truck that our neighbor would like to donate for a business or a family in need. And I'm thinking, Eastern Oregon, you know how many people out there need a pickup truck? Hello. So Ron, I saw you getting ready to talk and I didn't want to miss it.
Well, and that was exactly where I was going with this. So there's the students, and then there's the goods and services aspect of this. So when you're looking at disaster preparedness or disaster response or recovery, this concept of, hey, as a business owner, I've got 500 bottles of water sitting in the back that actually I just need to get rid of, right? And then you can post it in there, and to consider those can be readily distributed, or shoes or trucks or what have you. So John, thank you for sharing that connect, and I appreciate that testimony on this. Indeed, it's very powerful.
Is there anybody else? We do have kind of like a, hey, what's next that's coming up, but is there anybody else that can think of off the top of your head? How would you use this? How would you use this in your business or your nonprofit organization or your community to connect, to be community? Does anybody have any examples? Or if you've lived through it in another area and have some testimony, we'd love to hear that too.
Hi, my name is Megan, and I work with DHS in Multnomah County. So the first thing that was coming to mind when I'm listening to everybody talking about all the different ways CRN is being utilized, it makes me think about foster care recruitment, and if there is a way that CRN could help organize and rally community partners together to help us recruit foster parents, because that's one of our greatest needs as a system. And I don't really know what that would.
Yeah,
That's kind of where my brain goes.
Yeah, I'm with you on that. I feel like it could be any subject, right? It could be foster care, it could be any subject. So how the system works is a member. So Megan, if you were a member in the system, you would upload a need, right? So you would be, if I'm hearing you correctly, you would be representing your office, right? In saying, hey, our office, right, here in Multnomah County, located at such and such, right? Or whether it's an email or physical address, is really interested in hearing from people who would be interested in getting some information about being a foster parent or interested in becoming a foster parent. Doesn't matter who you are, reach out. We'd love to meet you and have a meet and greet, right? Or learn more or share more, right? Same thing if someone, if Kim Tran or if Justin from Salvation Army, same thing. If Salvation Army said, hey, we're really interested in learning, right? Who out there in the restaurant community, right, has food to share with those fire victims that are living in hotel rooms? Hit me up at, right? And he puts his contact information in there. So it really is, you're getting it. It's an electronic platform. So a person has a need, an organization has a need, a business has a need, or something to share out. Just put it out there and then connect, right? Let people know where to connect with you and how to do that.
Indeed.
That's really a great question.
Pretty powerful. And Megan, thanks for asking that question, framing it up. It is really universal. And I know we have some space for a little more Q&A later, but some folks may need to scoot now. We do have a next steps, like what would happen? How does this, what can we look forward to in the future? Brenda, maybe bring up our friend Amy to help share on that.
Amy Church, what happens next?
Hi, everyone. So the next steps are we are looking for members, people to join a steering committee and a backbone organization. And so if you are interested in either of those items, please fill in the interest form at PDX-CRN.org and indicate that you're interested in that. We will also have an opportunity for you to respond to, thank you for dropping that in the chat, Tim. And we'll also have an opportunity for you to express that interest via follow-up emails. We will be hopefully establishing that steering committee and having our first meeting in the middle of August. So time is of the essence. So if you're interested in that, make sure, again, sign up at pdxcrn.org and indicate your interest in the little description box.
Indeed, it is exciting. And then from there, we're aggregating, we're pulling together all the interested, forming this steering committee, and then deciding the next steps and timelines. And by following that interest form, it's a smart sheet that is pulling together all the different parts of the interested parties, and will help move it forward in the coming months. So thanks so much, Amy. Now, we did have some time for a bit more Q&A, right? And one of the ideas was, is there any, this is an open forum time, so we're gonna encourage you to go back to gallery view and see who's in the room. And let's turn on the cameras and maybe talk about for the next about 15 minutes we have together about any questions. How does this work, or where it might fit or not fit? Anyone?
Hey, Ron, I heard a question. I just got a private question in the chat that said, do you think that the network could function as a way for providers to convene around a particular area, like transportation or housing? And I was responding to that one-on-one, and it occurs to me other people might be interested. So if the community has a need, right, and wants to convene, something that I love about the network twofold is there's an opportunity to do a shout out, like, hey, giving a date and time. This at this date and this time and this location, we're going to be getting together and talking about this particular subject. Come one, come all, right? And it's kind of a one-stop shop to get that word out there. Something else I love is the functionality that it has for producing that newsletter that gives opportunities to celebrate, right? Hey, this is what's gone well. Give some data on where collective impact has been made, and a shout out, right? Hey, there's a forum going on or a convening going on, things of that nature. So I do think that that's possible.
There's also the quarterly meetings, Brenda, that happen that are hosted by the Backbone organization. And at those quarterly meetings, if there's a subgroup that needs to meet about transportation, that's an opportune time to have those sidebar meetings with the other stakeholders.
Yeah, I see Tim Park put a post in the chat with a hyperlink to Eastern Oregon's Community Resource Network newsletter, if anybody wants to check that out and see what it looks like. How about questions? We haven't really heard from a lot of folks verbally, and I don't want to call anybody out. So if you want to drop your question in the chat, that's fantastic. Or if you just want to unmute yourself and kind of popcorn, let's just throw some things out there. What do you like about this or hate about it?
Brenda, I'm seeing questions in the chat, and Amy, maybe you'll start with that about just comparing 211 and Unite Us and Connect Oregon. And so how does that interface with the CRN? Is it duplicative? Is it mutually beneficial? Do you want to share a little bit, Amy?
Yeah, so the CRN is really a complement to the other closed circuit or closed loop referral systems like Unite Us, or other referral systems like 211. When you call 211, you get a list of resources and you have to comb through and go to each and every single one of those resources. You would still want to check 211 when using the CRN, because there might be a way to get your resource faster and more immediate. But if not, you have the CRN as a backup, and you load your ticket to the CRN and it goes out to the whole community, and the whole community has the opportunity to respond. With Unite Us and other organizations, other closed referral systems, they're really a case management system where you're following a case and it's for those higher intensive case management needs. This is a facilitator. The CRN is a facilitator to connect someone who has something with someone who needs something.
Can those other resources be members of the CRN?
Absolutely.
And they are, right, in other areas of the state. Yeah.
And it's not complex to set this up. The platform's already made. And what's really cool about the platform is the sharing amongst the CRN platforms. WASI's created it that Eastern Oregon came up with some very innovative things they wanted changed on it. And within a day or two, he changed the platform. A lot of platforms out there that are the bigger platforms, it may take weeks, months, for a change to happen to really address some glitch or an opportunity or whatever it might be. Whereas this platform will get feedback from the steering committee, and they said, wow, if it could only do this. And the next day they say, all right, that's going, go ahead, now it works. And then they share that with the other platforms. And Marion County says, wow, we love that. We want our platform to do that too. So really there's a sharing in it, but there's also a customization for what fits that community, because all success happens locally. And this is all built on a simple concept. A lot of a little is still a lot. If everyone can do something, the power of that is pretty amazing. And
Indeed.
These other closed loop referral systems really are handling higher level complex needs, of which they could use the CRN as part of a tool and a help in that, but they're very higher level. So you still want those, and they complement each other. They don't compete, not in the slightest.
Indeed, the power of community. It looks like Megan has another question, and for others, if you raise your hand, use the reaction, we can get you queued up here. Megan.
Oh, yeah, I just had another just kind of quick question about, so once you say you put in a ticket for an identified need from your agency or your client or whomever else, then the facilitator from the CRN, their basic role is to connect you to other people within the CRN network, but is there like involvement after that point, or is it mainly to be like organization A meet organization B, and then it's up to those organizations to kind of partner and work together from there? Or does CRN kind of stay involved throughout that process?
That's a great question. So let's go back to the example I used with the teacher. The teacher filled out the ticket. The CRN looked at the ticket, made sure it was broken down into, sent it out. The algorithm picked up 3 groups. One was the Boys and Girls Club, who did the transportation. There was a nonprofit who had free eye exam vouchers. And then there was a small State Farm office who all pitched in $20 to buy the glasses. Now that information went back to the teacher to say, here's the 3 entities that can help you out. And then the teacher made the call. So it puts it back into the community. But now the teacher has 3 new relationships: Boys and Girls Club, the State Farm, and this other nonprofit that she can lean on and not even use the CRN anymore and call directly if she wants. And so it puts the power into the community and the people.
Okay, thank you. That makes sense.
There's another good question in here. I want to scroll up. Amy Merrill from the Cupcake Girls wrote, what does the notification to members of the CRN look like? Is that an email? Do they have to log into the CRN? What's that look like?
So members receive an email notification based on their profile criteria. So like Tim was saying, only if your profile matches the request will you receive an email. You can also opt out of receiving emails, and you can log in to the system to see every request in case there's one that you missed, in case there's a question that you, or a request that you missed that you wanted to respond to.
Hey, speaking of responses, so Justin, Salvation Army writes, you said you're getting a response within 45 seconds. I want to qualify that sometimes, right? Does the approval get to X service provider and get issued by the system based on a criteria that the service provider has already said that they would do? Or is it obvious everyone is not sitting around waiting for the CRN to send them a request to get approved and then they act on them? So does someone on the other side have to take an action to receive the request? What's that look like?
Brenda, do you want, go ahead.
Go ahead and explain that.
Yeah. So Brenda, what happens is, like, we have administrators for CRN. And the reason why we have the administrators is because we want to be very mindful of the family or an individual who is in need. We don't want to disclose their PII or medical or any health information. So when a request is submitted, it automatically sends an email notification to anybody who in CRN who has the role of an administrator. And it can be any number of administrators. So the moment the request is submitted, an email notification is sent out to the administrators. And as an example, even with Eastern Oregon, we have seen the administrators they get the notification on their mobile devices. So they could be carrying a cell phone or something. even when they're traveling or whatever, even if they're out of the office, they can just see the request and immediately approve it within a matter of like a few minutes. And then that request, once it is approved, that's when the notification, then the software uses the algorithm to match the request profile. So in a request, you are defining what is required and where it is required. And that gets matched with all the member profiles who have selected the category. So if there's a dentist and they want to provide only dental services, but suppose somebody is looking for some medical transportation, then the dentist will not land up getting the request to provide medical transportation or providing another form of transport. So there is a match, and then only the requests are sent out to all the member organization. And like Amy mentioned, if a member organization, a member has opted out to receive an email, they always have the option to log in and see what is required. So it works both ways.
Amy, would you share
Great.
the CNA example, the licensing, the $64?
Yeah, so we had a client, there was a client going through a self-sufficiency program, and she was in a CNA program and needed to pay the fingerprinting fee for her licensure and couldn't afford that licensing fee of $64.50. And so the self-sufficiency program loaded it up to the CRN, and within minutes they had multiple people responding saying, I'll pay that $64.50. And so we were able to connect that client with the need, or with that funding to be able to get their CNA license. That licensing, the money went to the agency, who then paid the fee on her behalf. So the money didn't go directly to the client. And it has the potential to change someone's life, because the $64.50 was holding her back from getting her licensure. And once she has her license, she's able to earn a livable wage and potentially, go on to serve in other volunteer opportunities.
Yeah, that's fantastic. Amy, something that I love about this is it's kind of a place where people can submit a request, right? It lands there. The notice goes out to all of the members. There's an administrator, like Wazi talked about, which we've also referred to as the backbone organization, that's receiving the requests and putting them out to the right members to answer those requests. Somebody in the chat asked, how is this funded, right? It's just an electronic platform. So and this kind of dovetails into our next steps, right? So this is all owned by the community, right? Members of the community, all of you who are interested, right? And more can come, right? Members of the community belong to this system and own this system. There's a steering committee that's selected. So if you're interested in serving on the steering committee, I know there's still spots available for Washington County, Clackamas County, and Multnomah County. So just drop a interest form. There's a electronic interest form at PDX-CRN.org, and we'll have that for you in the chat. It's basically just on the website, but you can fill out that interest form saying, hey, I'm interested in being on the steering committee, or I'm interested in being a member in the CRN, or learning more about it, or hey, we're interested in being the backbone organization that facilitates the connectivity of these requests, right, with the responders. Whatever your level of interest it is, we'd love to know, because that's the next step, pulling the steering committee together. The steering committee reviews and selects ultimately the backbone organization, and the backbone organization is the host for the system that already exists. It's ready to go. It's plug and play. Unless you needed to adapt it for some reason. I think Tim mentioned Wasi did some adaptations for Eastern Oregon, and I know that for some of the Portland area, Wasi, you did some adaptations for emergency preparedness, right?
Yes.
Yeah, all right. So those are the next steps. Just let us know what your level of interest is. The backbone organizations typically receive grants and contracts from other organizations, agencies, philanthropists, other folks to facilitate the system. So beyond that,
Indeed, it is exciting. The next steps are really driven by community. We have just a minute left and to wrap the program. I wanted to make sure to say thanks to all the guest presenters here, especially Tim. Thank you for your work in lifting this up, WASI and the technology and all those coming together, modeling this in other communities to help go forward in this community, in the Tri-Counties. It's exciting as Amy and Brenda for your enthusiasm, for your engagement in terms of just lifting this forward from down in Marion County, right? and having this happen here in the Tri-County. So as Brenda mentioned there, please hit that interest form. That's what we're going to use primarily. And then also just note that this session again was being recorded. There is a YouTube channel that we'll share in the follow-up communication, as well as in the chat that you can go to for a recording in the slides, but also that this Zoom address, this very Zoom, if there's somebody else, 2, maybe 3 people that might have resources to share, that might be a force multiplier, and this might be part of a community difference maker, send them this Zoom address, or better yet, go to PDX-CRN and register for some of the coming. There's another one of these sessions tomorrow for Clackamas, and a makeup session, Tri-County makeup session, which is indeed next Thursday. All right. Is there anything else before we wrap it, or how did we do? Got it covered?
I think you covered it.
Awesome.
Thanks,
All right,
everybody. Appreciate you.
Final shout out to the Best HQ team on the back end making this happen, and to everyone here taking the time. Let's go make a difference together.
Thanks so
everyone.
much.
Thanks, everyone.